name is Andrew Anderson. I'm an assistant professor in the Department of Health Policy and Management at the Bloomberg School of Public Health. So I'm interested in how healthcare is paid for and how those choices impact the health outcomes for historically marginalized populations, economically and socially disadvantaged groups like low-income families, racial and ethnic minorities in the United States, people with disabilities, sexual and gender minorities, because I believe that improvement follows where the money goes. So we really have to create incentives, build it into the system so that doctors and health insurance companies, pharmaceutical companies, and other providers have the resources that they need to address and improve population health. I studied public health in undergrad. So I went to the University of Maryland, College Park, and they had a newly formed school of public health. They'd had public health programs there for a long time, but they formalized it into a school. And I initially started as a biology major, and I was interested in entomology, which is study of insects, worked on a farm, did this sort of National Science Foundation research fellowship, and then I got interested in research, but I knew I didn't really want to go into biology as a biologist. I took an intro to public health course in undergrad, and then from there I sort of was like, this is what I want to do, and I continued that up until today. So directly after college, I worked mostly in community health. So I worked, with the Howard County Health Department, the Prince George's County Health Department, their action, it's called an action coalition, which is a group of kind of local business leaders and community organizations that provide input or feedback to the health department on what the priorities should be for the health department, the health officer there. I also worked at a place called the Latin American Youth Center, where I helped with a community advocates program, which is around training youth to go out into the community, their families, their neighborhoods, and try to educate the people in their community about good health behaviors. So I've worked in a variety of these sort of health education and outreach positions. I was like random things going to the YMCA to give talks on cardiovascular disease and cancer prevention. And even I was Howie the health dog for one day to walk kids to school to teach them about, being active. So I did a bunch of these sort of like community health worker type roles when I first graduated, and that exposed me to a lot of local issues and put me in front of a lot of people who are directly experiencing a lot of the health challenges that I study today. So I started my career in Washington, D.C. in the health policy space, kind of national. I worked at an organization called the National Quality Forum, which really is in place to help the Centers for Medicare and Medicaid Services select quality measures for payment programs. But through that, I was able to meet amazing people from across the health system, CEOs of major hospitals, academics at different universities across the country doing research to improve immigrant health, improve the health of people who are living with disabilities. Also folks who are, doing community-based work, as well as advocacy groups that are doing work on behalf of patients and families. So there was a lot of my initial exposure to the healthcare system and its problems came from speaking with those experts and facilitating and being a part of those conversations from an early point in my career. Yeah, so I was in the first cohort of a program called Health Policy Research Scholars. This was back in 2016. I saw the Robert Wood Johnson Foundation advertised it through, I think it was pushed through my department, was at the University of Maryland, College Park. The program is for researchers, pre-doctoral students from underrepresented backgrounds, and they provide all sorts of supports for forming your research interests from a health equity lens. They also provide resources to help you get through your PhD program and sort of a community of other scholars, like-minded scholars from across the country, from different universities that can help support just the difficulties of getting through a PhD program. So HPRS was hugely helpful in also shaping me as a researcher, and I still collaborate with people from my cohort and subsequent cohorts, and I try to stay involved in that program. It's been hugely helpful for for me, just to kind of become who I am now. So, and I still lean on the program. I've gotten mentorship through HPRS. Some of the folks that I mentioned before is, they were assigned mentors through the program. I got financial help through the program. I also got a research community that I can always tap into. Actually, we're writing papers together. We're writing book chapters together. So these are people who I will continue to collaborate with throughout my career. So those would be probably the three main areas that HPRS has helped. I think my parents didn't know what it was. So public health is really big now because of the pandemic, and there are schools of public health popping up all over the place. But my immigrant parents absolutely wanted me to go to medical school or to, go to something that they were familiar with, law school, medical school. My dad was an electrical engineer. Why not go into engineering? So they were fine as long as I went into something they were aware of and that they knew, I could make a living doing. And so once I taught them sort of what public health was and the potential jobs that I could have, then they were completely on board, and that was fine. I tend to run a lot. I like going to the gym. I also read and write a lot. Sometimes I write about what I read. I like novels, so historical fiction, classics. Sometimes I revisit old novels that I read back in high school or in college. So I'm always reading. I read in the mornings when I get up, and something kind of non-fiction-y, sometimes the news, and then at night I'll read something fantasy because it helps me go to sleep. But I also like board games, strategy games. I like cooking, so especially cooking with others and baking. So yeah, a lot of things anything that really involves me getting around people and spending time with people that I care about. So I like Settlers of Catan. I think that's really fun. I like chess. I used to play chess in high school, and I recently got back into it. Sometimes it's hard to find a player, but it's always fun to play. I don't play Monopoly anymore because it causes too many problems. People get very aggressive about Monopoly. But I would say those are, maybe those are the top three, but definitely Settlers of Catan because it's, and then I also like some of the niche board games, but I don't end up playing them as often because then you have to teach everybody the rules again. So I also end up playing the same games.
Makes sense.
So I've worked on a lot of very interesting projects. One that comes to mind is a project that I worked with a group of doc students on a couple of years ago, which we were looking at the cost of health disparities related to preventable heart failure in the US South. And we found that it costs millions of dollars to the Medicare program to sort of have these disparities persist. And so it's interesting because typically we think of disparities as being a kind of just a social problem, which it absolutely is, but there's also an opportunity cost to not addressing it. And we don't typically run the numbers on what it's actually costing us year after year. And it's related to some work that I've also done with another team here at Hopkins and at Tulane. A lot of the reason why that work, yes, the findings are illuminating and policy relevant, but I enjoyed the collaboration that came through that work. It was very much, ideas that sort of started, in a very kind of unrefined form, and then everyone contributing made it better and better, and I liked working with those people. So it would be a group of people. So immediately I think of folks like Helen Burston, who was at the Agency for Healthcare Research and Quality when they had produced their first health disparities report nationally. And also she was at the National Quality Forum, and it was served as a mentor for me. Folks like Sarah Hudson-Sholey at the National Committee for Quality Assurance, who worked there tirelessly for decades to improve the quality of healthcare through the health plan and health insurer perspective. Folks like Nina Ponce at UCLA, who helped develop the California Health Interview Survey and worked to try to improve immigrant health in California and nationally. Lots of people, even folks in this department that I worked with before coming to Hopkins, like Daryl Gaskin and Tom Leviste, who helped set up the Center for Health Disparities Solutions here at Hopkins. So it was really a village of people who influenced me and helped shape my research interests and helped me get into health services research where I am now.